Hello everyone, welcome back to my channel. In today's video, we are going to see some coding guideline questions. This is very important for the CPC exam. In the CPC exam, you will get 7 questions from the section Coding Guidelines. Let's start with the first question. Which statement is true about Z codes? Option A, Z codes are never reported as a primary code. Option B, Z codes are only reported with injury codes. Option C, Z codes may be used either as a primary code or a secondary code. Option D, Z codes are always reported as a secondary code. And the right answer is option C, Z codes may be used either as a primary code or a secondary code. If you don't know the answer for this, you can check in your ICD manual, Chapter 21, Factors Influencing Health Status and Contact with Health Services, that is Z codes. Under that, you can find the first guideline, that is Z codes may be used as either a first listed principal diagnosis code or secondary code depending on the circumstances of the encounter. Therefore, the right answer is option C. Next question. The phrase separate procedure when listed in parentheses at the end of a CPT code description means that, and the right answer is option B. The code should not be reported separately if the service described by the code was a component of a more comprehensive services provided during the same encounter. Next question. Which of the following is not acceptable method of reporting CPT codes for surgical services when no single code accurately and fully describes the service performed during a particular outpatient surgical session? So they're asking which of the following method is not acceptable for reporting CPT codes for surgical service when no single code accurately and fully describes the services performed. So the right answer for this question is option A, that is, report the code that most closely reflects the physician work involved even if the code does not exactly describe the specific services performed. So this is not an acceptable method. Next question. Which of the following is a key difference between add-on codes and modifier 51 exempt codes? Option A, the modifier 51 exempt codes are never reported with a modifier. Option B, the add-on codes may be reported in addition to other codes for services provided during the same encounter. Option C, add-on codes are never reported as stand-alone codes. Option D, an add-on code is never reported if the service provided is a component of a more comprehensive service provided during the same encounter. And the right answer for this question is option C. Add-on codes are never reported as standalone codes. Next question. Which of the following is not considered a part of the CPT surgical package? Option A, all E&M encounters on the same day prior to the surgery and the day of the surgery. Option B, local anesthesia. Option C, evaluation of the patient in the recovery area. Option D, typical uncomplicated follow-up care. And the right answer is option A, all E&M encounters on the day prior to the surgery and the day of the surgery. Next question. Which symbol is used in the CPT manual to indicate that the description of a particular CPT code was revised for the current year? And the right answer is option C. You can easily find the symbols in your CPT manual inside front cover.